we continue supporting the idea of integrating the MSK sonography into physiotherapy approach. So today we're going to talk with Robert Laus, who is the founder, director and head faculty to SMAC training. Rob, thank you for having you here. It's a great pleasure. So let me jump straight into the questions. What do you think is the most effective way to integrate, as a physiotherapist, obviously, the MSK ultrasound into daily assessment without overcomplicating the process?
Yeah. First of all, I think you need to see ultrasound as an extension of your clinical assessment. And if you're a physiotherapist, you're used to with your hands, and ultrasound is very much an extension of your hand. So it is a natural way for physiotherapists to work, and it gives you much more information. So it should be, for most of us, not too difficult to get into. It takes a little bit of getting used to the anatomy and how it visualizes on the ultrasound. But once you get that, the information you get is very useful to make not only diagnostical decisions, but also in the management of your patient.
Okay.
And that is what you need to do. So it's the future. If you haven't done it yet and you want to be interested in working in sport medicine, you really can't get away from it.
For students who are hesitating to invest in ultrasound training, what would you say about the impact SMAC has on real clinical outcomes?
It has a great impact, because what we do is we teach people to appreciate the diagnostic sort of subcategories that you find with ultrasound. So that's the diagnostics. You get better at diagnostics, and then from there you make much better and more specific decisions in your management, and so your outcomes are generally going to be much better. So the impact that we find at SMAC is, overall we see better clinicians, higher trained clinicians that can talk to other specialisms as well, like surgeons or radiologists, and in their own setting are getting many more patients through their clinic with specific questions that they can answer. Does that answer the question?
Absolutely. What's one technique that physiotherapists can start practicing today to sharpen then ultrasound interpretation skills?
When I started, one of the first things I realized that was really useful is, if you're already a clinician, as we are, a physiotherapist, and you palpate and you feel, you always think of it in your head what that looks like. You have an image in your head what that looks like, that structure.
That's right.
So the next time you pick up a probe, and if you put it on a structure that you know, and then you put your finger in the middle of your probe, so from left to right in the middle, and you push down, you can actually see what your finger is palpating. So you very quickly get much better at palpation skills and much more accurate, and you'll be realizing how maybe you haven't been as accurate as you think. So that's the first skill, because it translates back in what you do already, and you start recognizing the structures. Yeah.
Great. But can you say what's the most common detail that physiotherapists tend to miss during ultrasound scanning?
That is a difficult question to answer in so much it depends where you work. Okay, I think it's not so much what they miss. I think you don't look for it and you assume. So what a lot of physiotherapists do, they assume too much. So if you have a bursitis, you assume it's a swelling and it's inflamed, and it often isn't on the ultrasound. If you have tendinopathy, there are many variations. It's not just a thickened tendon. There could be calcification, there could be little tears, there could be a little bursa swollen next to it, or there could be a little bit of an enthesitis. So there's a lot of nuances, and so in your question, what we miss is often the nuance and the detail, and we are simply making too many assumptions.
Okay.
Yeah, and that you won't be able to do anymore when you do ultrasound.
Okay, great answer. Actually, if you could give a single best practical tip for a physiotherapist who wants to reach the SMAC level competence, what would it be?
So get a machine, then make time to revise your anatomy and be prepared to be curious and to just invest the time for that. Yeah.
That was very lovely talking to you. Thank you so much for your time. And for more information, I will post the links to SMAC training into my descriptions if you want to check out.
Yeah, no worries. Anyone can contact us. We're very approachable, or you can always contact yourself, and then we just take it up from there. But please be enthusiastic. Don't miss out on this tool. Yeah.
Absolutely.